Hello and welcome to Inside Chlorpromazine. I'm your host Sowmya, and in today's episode titled Storm Chaser, Can Chlorpromazine Tame the Cytokine Storm? We're diving into one of the most dangerous features of severe COVID-19, the immune system going to overdrive. We have heard about ventilators, oxygen therapy, and antivirals. But what if a repurposed psychiatric drug could help regulate the immune chaos itself? With us today is Chythanya, a microbiology researcher with deep insight into immunopathology and host virus interactions. Welcome, Chaitanya.
Thanks, Sowmya Dilemma. This is one of the most crucial and misunderstood aspects of COVID 19, and I'm very glad we are unpacking it.
Let's start with the basics. What exactly is a cytokine storm?
A cytokine storm is a hyperinflammatory immune response where the body releases excessive levels of cytokines. These are small proteins that help regulate immune activity. Normally, they are protective, but in some COVID 19 patients, the system goes into overdrive. This overactivation can cause widespread inflammation, blood clotting, multi-organ damage, and even death. It's not the virus alone. It's the immune system's overreaction that often leads to severe outcomes.
So, where does chlorpromazine fit into this?
Chlorpromazine is the best known as an antipsychotic, but it also exhibits immunomodulatory properties. Studies have shown that it can reduce the production of pro-inflammatory cytokines like IL-6, TNF-alpha, and IL-I beta, all of which are elevated in cytokine storms. What makes chlorpromazine interesting is that it doesn't suppress the entire immune system like a steroid. Might instead, it seems to rebalance the immune response, which could be less risky in viral infection.
Is there any research backing this immune calming effect?
Yes, there is going on evidence. Animal studies and in vivo or in vitro experiments have shown that chlorpromazine can reduce inflammation in models of lung injury and sepsis. Specifically, it lowers the levels of key inflammatory mediators in the lungs and bloodstream. In COVID-19 models, chlorpromazine treated cells shown as blunted inflammatory response to viral stimuli. It doesn't completely shut down the immune system, it just prevents it from going into the dangerous oversight.
Overdrive. You mentioned IL-6 earlier. That's a major player in COVID-19, right?
Exactly. ISS is a cytokine that's often sky high in severe COVID 19 cases. Elevated IL-6 is associated with poor outcomes, including respiratory failure. Chlorpromazine have shown to suppress IL-6 production in immune cells, and since IL-6 inhibitors like tocilizumab are already used in clinical COVID-19 care, chlorpromazine's ability to modulate IL-6 is particularly relevant.
That brings up an interesting point. Chlorpromazine acts on the brain. Could its effects on the nervous system be influencing the immune response too?
Yes, and that's fascinating area of emerging research. The brain and immune system are deeply interconnected. Neurotransmitters like dopamine and serotonin, which chlorpromazine affects, can also influence immune cells. Chlorpromazine's calming effect on the autonomic nervous system, particularly the vagus nerve, might indirectly reduce inflammation. It's part of what's called the inflammatory reflex. So, we are looking at a drug that may work on multiple fronts, directly on immune cells and indirectly through neural immune signaling.
What about long COVID, where people have persistent inflammation? weeks or months after infection?
That's a very great question. Many long COVID-19 patients show signs of long grade chronic inflammation, especially in the nervous system. Some hypotheses even point to residual immune activation as a cause of fatigue, brain fog, and joint pain. If chlorpromazine can restore immune balance and reduce neuroinflammation, it might be useful in that context too. Though again, clinical trials would be necessary to confirm this.
Chloropromazine sounds promising, but what about side effects?
It does have a safety profile that's well documented since it's been used for decades. Common side effects include sedation, dry mouth, dizziness, and high doses. Extrapyramidal symptoms like muscle softness, stiffness. For immunomodulatory use, the doses might be much lower than psychiatric doses, which could reduce side effects. But still, it should never be taken without medical supervision. This podcast is not providing medical advice, Raichu.
To sum it up, chlorpromazine may help regulate the immune system in COVID-19, particularly by dampening cytokine storms. It modulates inflammatory cytokines like IL-6 and TNF alpha, potentially offering protective effects without full immune suppression.
Yes, and it's a great example of how old drugs can find new purpose in emerging medical challenges. There is a real need to explore safe, affordable anti inflammatory agents that don't compromise immunity, and chlorpromazine fits that bill.
Thank you, Chaitanya, for bringing this down for us. It's fascinating to see how a psychiatric drug might help calm the body's own immune chaos.
Thank you for having me. It was a great conversation.
That's it for this episode of Inside Chlorpromazine. Join us next time as we dive into episode 11, Crossing the Line Chlorpromazine and the Blood-Brain Barrier, where we'll explore how this molecule interacts with the brain during COVID-19 and what it could mean for neurological symptoms. Until then, take care and stay curious.